What are the biggest inequalities that you have seen really be highlighted throughout this pandemic in San Antonio?
The pandemic has hit our community extraordinarily hard, and you've seen it exacerbate existing inequities, particularly among communities of color and those communities in lower socioeconomic income brackets. It has disproportionately affected the people who can least afford to be impacted. And that's why it's shaped our approach to the recovery effort, from the immediate crisis response to how we're going to rebuild our community when we're through the immediate health crisis. We're focusing on the essentials. How do we make sure that people don't lose their homes as a result of coronavirus? How do we make sure that people continue to have food on the table to feed their families during the coronavirus and afterwards? And then from an employment standpoint and making sure that people can sustain themselves, how do we get people back to work when it's safe? And for many, too many, how do we ensure that those whose jobs may not come back very quickly or come back at all have a pathway to a sustainable career after this? So that's kind of where we are, but we've seen San Antonio be very heavily impacted because of the existing inequities, which are found throughout the country in urban areas like ours.
And like you said, these were problems that existed well before this pandemic hit, and they are not problems with easy solutions. There's some that maybe have been around for generations for a lot of San Antonio families. So what work is being done now on top of the work that's happening moment to moment trying to prevent the spread of this illness? What's being done to try to keep those families, those communities either on track or get them back on track?
Well, I mentioned some of them, simple food, shelter, essentials. But we also have to recognize, in order for us to have a healthy community at any level, we have to have healthy people. And so our response has to first consider the fact that equity results from health and well-being. So making sure that we're reaching communities and ensuring there's testing available, there's information about preventative health maintenance available. Beyond that, we have to look at our systems of inequities. There is a level of generational poverty that we have to focus on and break here in San Antonio. And that has a lot to do with education, providing people pathways to post-secondary education, technical certificates. So we have had to take a systematic and comprehensive look at the way we build our communities in order to overcome some of these systematic inequities and deficiencies that we've had for generations.
There are people within the San Antonio community who have not had to seek out those resources like the food bank during this pandemic. They have not lost their jobs. They have not been furloughed. Maybe they're just having to stay home and focus on their health. What would you say to those people who haven't really seen these big problems arise in their own homes? Why are these other issues that may not be affecting them, why should they care?
A lot of people talk about urban areas like ours, particularly San Antonio, as being a tale of two cities. There are many people in our community that the pandemic is an inconvenience, for sure. It's an inconvenience. But their livelihoods are by and large intact. But there is a whole other side of this world, a whole other side of our city, where people are not as fortunate. I would simply ask folks who weren't so dramatically hit by this pandemic to consider the people that we share our community with. In order for us to have a healthy city, a healthy community, we have to bring everybody back up. Everybody's got to get back on their feet. And so it requires us to focus on those who are most disadvantaged in our community to ensure that they're okay, that they, are able to make ends meet, they're able to feed their families, they're able to keep a roof over their head, and they're able to get to a career that allows them to do that even as we get past this pandemic. San Antonio was the first big city in the country to begin using an equity lens, an equity framework in order to allocate its resources. And we are by no means even close to restoring the levels of equity that would be required for us to have a resilient city but we have taken the first significant steps before this pandemic, and the pandemic has illustrated why we need to continue to march in that direction.
Is there anything else about this very big topic that we didn't cover you think is important to note?
No, this is very big. What I would say though is that this has been disruptive to us here in the city of San Antonio. It's been disruptive to every city in the country. It's been disruptive to the entire world. No one would have foreseen the earth-shaking nature of this pandemic a year ago. But with this and with the moral crisis that we're seeing, with the March for Justice that's happening, we have seen a reckoning in our communities all across this country, and a real opportunity. Every social and economic institution and structure is having to reconcile the vast inequities that have been built in, that have left some people out of prosperity, have left some people out of systems of justice for generations. But what these last 6 months in America have provided us an opportunity to do is take a full accounting of that in full view and allow us to rebuild and restore our community in a much more equitable manner, not just in San Antonio, but across the country. And that's a real opportunity. That's a real generational opportunity for us to leave a better world to our children and grandchildren.
A lot of heavy lifting still to be done. Mayor, thanks so much for your time.